I am Rebecca Jaffe with the UN Association San Diego, and we are here very much with the honor of Sara joining us. Thank you again for your time.
Of course, thank you for having me.
Absolutely. Okay, excellent. Well, jumping right in, we want to focus today on the UN Sustainable Development Goals and how it relates to your 53rd district and your congressional run. And so first off, want to get your thoughts on your top sustainable development priorities, whether that be zero hunger, quality education, and some of the other key SDG goals. And what are some of those priorities for the 53rd district and the biggest challenges to achieving them within your district?
Yeah, absolutely. So I, in addition to running for office, serve as the founder and chair of San Diego for Every Child, which is a countywide initiative to address childhood poverty here in San Diego. And even before COVID-19, we had about 40% of San Diego's kids living in families experiencing poverty, which we defined as access to healthy food, access to quality healthcare, access to early care and education, and access to stable housing. So that should give you some sense of the SDGs I'm most interested in focusing on. SDG 1, especially no poverty and childhood poverty, SDG 4, quality education, and then really thinking about SDG 10, reducing inequality and making sure that we're doing everything with equity in mind. Here in San Diego, we're obviously very impacted by climate change. And so SDG 13 around climate action, I think will be incredibly important for us. I think the next administration should rejoin the Paris Climate Accords. And I think we need to go even further than that and make sure we're really setting up the kinds of global governance structures that we're going to need to be able to address climate change with the urgency that it requires.
Excellent. Yes, and perhaps dovetailing right off of that, can you tell us more about the impact of COVID within your district? And if elected, what are some of the measures you would create and support to help your district through these challenging times?
Yeah, absolutely. I know a lot of people are really struggling with both the public health and economic crisis that we are in. So I think it's a real travesty that the federal government hasn't enacted further stimulus since the CARES Act. We know people really, really need the help. And so my priority will be getting those federal recovery dollars and making sure that assistance gets to those who need it most, to our families and our small businesses. For our families, I think one of the most important things we need to do for an equitable recovery is make sure we're investing in our childcare infrastructure, both because we know that families are really struggling with childcare right now, and even before the crisis, many San Diego families couldn't afford childcare, but also because quality early childhood education is an important component of making sure every kid has access to opportunity. And those childcare jobs are often done by women and women of color. And so if we can make sure that those jobs are good paying jobs and that our childcare providers can make it through this difficult time, that will be important for equity as well. And then we also have the public health component of this crisis, right? Because it's not just an economic crisis. I actually worked in global public health at UNICEF, and I was on Secretary Clinton's 2016 presidential campaign as one of her policy advisors. And one of my policy areas was global public health. We were working on Zika at the time, but worked directly with members of Congress on what kinds of legislation we would need to pass to better set us up to respond to a pandemic threat, which unfortunately, none of that happened. And not only that, we got rid of a lot of the protections put in place in 2014 by President Obama after Ebola. So I think we need a national mask mandate. I think we need a national testing and tracing and isolation program. I'm glad to see we are seeing such good developments on vaccines and therapeutics. I think it'll be important that those meet the highest safety standards. But in my experience working at UNICEF, when it comes to vaccines, distribution is often the hardest part and something I don't think we're thinking enough about right now. And so not only if we're going to need, for instance, a cold chain so that the vaccine can stay the same temperature through the whole distribution, but also that last mile piece where you're really figuring out how we can get the vaccine to those who need it most. And that requires trusted messengers. And so I think Congress needs to allocate funding for those trusted messengers, maybe even keeping the census infrastructure in place, since they're often similar community-based organizations, to be able to make sure that that vaccine is actually going to those who need it most.
Excellent. Yes, thank you for addressing the multifacets of the COVID response. Obviously, embedded within that is a discussion about healthcare and the access to insurance. I know you're an avid supporter of healthcare for all. Could you please perhaps expand a little bit further on funding such a program and, of course, managing the federal deficit as part of that initiative?
Yeah, absolutely. I think healthcare is a universal human right. And I've looked at countries around the world and how they've gotten to universal coverage. And I think it's clear that a single payer-like system, a Medicare for all-like system, is the most efficient way to get to universal coverage. So I support Medicare for all. I also think that it's important that when we're talking about universal coverage, we realize that that's only one component of universal health care. So we also need to be talking about what kind of care people are getting. We need to be talking about quality and about access. And I think when it comes to access, there's actually quite a lot we can learn from our ability to expand healthcare in international development, right? We invest in community health workers. We invest in these community-based organizations that are really close to the communities they're trying to serve. And I think learning from those models and figuring out how we can extend access here will be incredibly important, regardless of what insurance coverage system we end up putting in place. Now, in terms of paying for it, I think that there's a few answers to that. So the first is that the United States has the highest healthcare costs of any country around the world per capita. And that will stay true whether it's the individual at the point of service or the government paying that cost, right? So we need to figure out how to bring costs down. Having a single payer system where the government can negotiate pricing will do a lot, but it won't do everything we need to do. I think we also need to cap prescription drug costs. And we're one of only 2 countries around the world that allows pharmaceutical companies to market directly to consumers. I think we should ban that like much of the rest of the world and make sure all of that money is going to research and development. And I think there are some other interesting things we can do around prizes that could help incentivize innovation, but keep costs down on the like price per pharmaceutical, price per drug cost. And then we also need to talk about payment reforms, changing the way we actually do the fee-for-service model so that we aren't just keeping the same healthcare system in place that we know is broken. And look, right now we're in an economic recession. We have seen the federal government have to spend trillions of dollars. I think right now we can actually think of healthcare spending by the federal government as an important stimulus because businesses pay about $500 billion a year on healthcare costs. If we take that off the businesses' books, even if we're taxing some of it to help pay for this, you'll be able to pay your workers more. So you'll see hopefully some wage increases. If we take the Medicaid budget off of states' balance sheets, and give it back to the federal government, you'll be able to see states investing in schools and education and infrastructure and all these things we know are really needed. And so I think, especially given the economic crisis we're in, doing universal health coverage through deficit spending is not the worst idea because we actually need that government stimulus.
Thank you. Thank you for your response on that. Circling back and kind of a combination of some of the topics you've already discussed, with regards to social protection, do you think an adequate amount of resources are being allocated directly to address homelessness within our area and poverty reduction and some of these other elements that are a big focus? And can you tell us more about your plans to provide access to resources for vulnerable populations, both within your district and within the county and state at large?
This is a crucial question. And no, we're not doing enough to address homelessness here. And that's in part because while pre-COVID, San Diego was the 4th largest homeless population in the country, we're only 20th in terms of funding that we get from the federal government. And that's because the federal definition of homelessness does not really address what we know homelessness looks like here. So if you're sleeping in your car, if you're couch surfing, if you're housing insecure, that's not addressed by federal homelessness definition. And so we're not getting federal funding for that, even though we know that that's really what it is here. And so I'll work with members of the San Diego congressional delegation to push to modernize that funding formula. I think we need to expand the McKinney-Vento homeless outreach grants so that we have more funding to do the kind of homeless outreach and trust building that we know is incredibly important. And one of the things I'm really interested in is looking at programs to prevent homelessness to begin with. So in New York, they actually did this pilot where they paid for the public defenders to represent people in eviction court. And they were able to bring the rate of eviction down by something like 150%. So I think we should have federal funding to have representation in eviction court, whether it's the public defenders or what it would likely be here in San Diego would be the legal aid. Because we know that keeping someone in their home is better for them and it's better for the government in terms of cost effectiveness. So that those kinds of prevention investments I think will be important. And, I think part of what we saw with the CARES Act is that for all the good it did, it really missed a lot of the needs of the most vulnerable populations. And so I think the next stimulus package will need specific funding for housing relief, $100 million for renters relief, $75 million for homeowners relief, 750,000 emergency housing vouchers, just so we can help people make it through this time. I was glad to see that in the negotiated package to get the government funded so that it doesn't shut down. They were able to include expanding and keeping the expansion of the SNAP or the CalFresh benefits, but it's clear we'll need to do a lot more of that. And then one of the things I think we have a real opportunity for right now is that the way government assistance typically works is that if you are middle or upper income, you actually get a lot of help from the government, but it's kind of hidden. So it's a tax credit or a tax deduction. It's, these kinds of things that you're not feeling like you have to go ask for it. It's just like built in as part of the system. But if you're lower income, you actually have to go out and proactively get all of the assistance that you need. And it tends to be quite burdensome and it tends to be quite humiliating the way we make people do this. What I think is interesting and a unique opportunity is that because of this crisis, so many more people have had to deal with the kinds of assistance programs that usually were only for low income people. And they're now seeing how burdensome and humiliating it can be. And you're seeing small business owners who couldn't get the Paycheck Protection Program because it was too complicated and hard to access. You're seeing families who all of a sudden are applying for assistance who had never seen themselves as needing assistance before. And I actually think we have a real opportunity to fix our safety net so that we don't put that burden on families, that it's not up to the individual person to go to 10 different places, fill out a million forms, all this information, you get one thing wrong, right? That we're actually providing people the safety net and the help that they need without this burden and humiliation.
Thank you. And now transitioning to a related topic, but a slightly different angle on the SDG goals. As the supporter of the Green New Deal, can you elaborate on how you would achieve the transition to an entirely clean energy economy by 2030 and what that would mean for San Diegans in particular?
Yeah, so, I think we need to start with the most polluting sources of energy first. So that is coal generally, and then move from there. And I think we need big investments in new green technology and making sure that those new jobs are good paying union jobs. I actually think one of the things that will be important, and I worked on a white paper on this, is making sure we're infusing the stimulus package with our broader climate goals so that we're not inadvertently or advertently taking us backwards, but actually using the stimulus to not lock in high emissions industries and to incentivize those who get federal funding to have climate emission goals in line with the Paris Climate Accords. I also think one of the things that will be really important as we're thinking about climate change, you know, the UN has this concept when a peacekeeping mission goes into a new country, they have these quick impact projects. Basically, they put in place these projects that the population can immediately feel the benefit of, so that they see the benefit of having the UN there, and the UN then gains legitimacy. I think we should have a similar idea for these kinds of programs. And I think we have an opportunity as we're talking about building new housing, green retrofits of existing housing, that we can do things that advance our climate goals and have an immediate impact on people's well-being that will then help build support for some of the harder things we're going to have to do down the road. I also think we here in San Diego are really well placed to benefit from investments in the ocean. It's actually something I think is missing from the Green New Deal. And we know SDG 14 is very important. And making sure that we're using the ocean as a carbon sink, that we're thinking about how we can do agriculture and food production in the ocean, that we're thinking about how we can use the ocean for energy generation and energy production. And because of our proximity to the ocean, our high-tech workforce, and we are really well placed here in San Diego to benefit from investments in that blue technology.
Excellent. Okay, and that tees up our final question here quite nicely. Finally, there's been widespread discussion on the news regarding the future funding of the United Nations by the US government. It has been estimated that the average American pays only $1.86 each year in taxes to cover the country's regular budget dues to the UN. Especially in light of this, if you are elected, where do you stand on the full funding of the United Nations agencies? And do you have any particular preferences with regards to the future of such?
So I absolutely support the full funding of UN agencies. I think it's been really the wrong decision that the Trump administration has made to pull funding from the WHO, to pull funding from some of the agencies that serve Palestinians, from the Human Rights Council. I think that we are seeing right now the impact of having an international community be able to address transnational threats. And I think that while what we're going through is horrible, it's also a unique opportunity because Americans are really seeing the fact that we need these international organizations to function, and that when they don't, it directly impacts our lives, our livelihoods, our health. So I think that we not only need to make sure that hopefully with a new president in a few months, that we are rebuilding our alliances and rebuilding our leadership around the world, but also really thinking about what kinds of global governance institutions we're going to need for the kinds of challenges that we're facing. Because the UN system was set up after World War II. It was very important and it's done a lot of good, and we're now in a very different world. And so how can we modernize some of these institutions to make sure that they're really able to address things like a global pandemic, things like global climate change that affect everyone and require collective action by the international community? And I think right now we don't yet have the global governance structures that we need to be able to address some of those challenges.
Excellent. Thank you so much again for your time. I think this lends itself to a lot more in-depth understanding of your positions on these important topics and in the upcoming election. We really appreciate your time again, and wish you well as you continue forward.
Well, thank you, and thanks for all of the work you all are doing to bring the SDGs here to San Diego and make sure that people are recognizing the importance of what happens internationally for what happens to us here at home.
Excellent. Okay, Bettina, I think we're good.